Are you noticing new floaters, blobs, or flashes in your vision? New research is showing us that a surprisingly high percentage of patients who experience these visual symptoms have other potentially blinding conditions like retinal tears or detachments that should be treated right away. By the way, I'm Dr. Michael Chua. I'm a board-certified ophthalmologist with Plainly Hills Eye Care, and I make videos to help you see better, look better, and feel better too. In this video, I'm going to review this study, its results, and what it means for our patients with flashes and floaters, and a condition we call posterior vitreous detachments. So let's take a look at the study, which was published in March 2023 in the journal Ophthalmology Retina by a team out of Rush University in Chicago. In this study, they looked at 9,635 eyes of patients who experienced new flashes or floaters and were found to have a condition called a posterior vitreous detachment. We all have gel inside the eye called the vitreous. A posterior vitreous detachment is when that vitreous gel which fills the eye separates from the retina. This process is usually associated with aging and often occurs in people over the age of 50. But certain factors can make it occur sooner, such as if you have high myopia or nearsightedness, have a history of eye trauma, or a history of eye inflammation. As we all age, the vitreous gel liquefies and shrinks, leading to its detachment from the retina in the back of the eye. And as the vitreous gel liquefies, parts of the vitreous can also form clumps or strands, which can cast shadows on the retina. These shadows can be seen as floaters. Vitreous detachments themselves are usually harmless, but as that vitreous gel detaches from the retina, sometimes it can cause a retinal tear. And if there's a tear or a hole in the retina, fluid can get underneath the retina and cause a retinal detachment, which is a medical emergency. If you have a retinal detachment, a retinal specialist will need to surgically repair it as soon as possible to try to prevent permanent vision loss. The other possible complication that can occur with vitreous detachments is that as the vitreous detaches from the back of the eye, it can pull and break a blood vessel in the eye, which leads to bleeding or what we call vitreous hemorrhage. All this blood in the eye can make your vision very blurry, or you can see large globs in your vision from the blood. It also makes performing an eye examination difficult because it's hard for us to see your retina if there's a bunch of blood in the way. Vitreous hemorrhages are usually also associated with retinal tears, so we need to be extra careful in patients who experience vitreous detachments with vitreous hemorrhage. So going back to our study, they looked at 9,635 eyes which experienced a new posterior vitreous detachment. They then followed and examined these eyes for 6 months after the patients initially came in to determine the rate of complications associated with vitreous detachment. Let's look at what the data showed. They saw that over a 6-month follow-up period, 25% of patients with the new floaters or flashes with the vitreous detachment, 25% of patients had a complication such as a retinal tear, retinal detachment, or vitreous hemorrhage. They reported that 16% of eyes had a retinal break, which would be a retinal tear or retinal hole. 13.1% had a vitreous hemorrhage, and 4.2% had a retinal detachment. This proportion of patients, 1 in 4 patients with a vitreous detachment having an associated complication, is, to me, quite high and clinically significant. The other interesting finding that they reported was that oftentimes, these complications weren't seen the first time the patient came in. They found that for many of these retinal tears and retinal detachments, these complications were found later, sometime within the first 6 months of follow-up. For example, they found that 25.8% of retinal detachments, 19.2% of retinal breaks, and 8% of vitreous hemorrhage were found sometime in the 6 months of follow-up rather than when the patient first presented to the doctor's office. These results show us the importance of following up with your eye doctor, not just when the symptoms such as floaters or flashes start, but also for the first few months afterwards, because these potentially sight-threatening complications can occur later. One last interesting result they noted was that men were found to have a significantly higher risk of having complications compared to women. They reported that 30% of men in the study suffered a complication such as a retinal break or retinal detachment with their vitreous detachments, compared to 21% of women. The theory is that on average, men have longer eyes, and these structural differences may play a role in increasing their risk of having retinal complications with vitreous detachments. Okay, so what does all this data mean for patients and ophthalmologists? Well, first, if you're experiencing new floaters or flashes in your vision, don't ignore it. Go see your eye doctor so that they can examine you closely for any new retinal tears or detachments, and also follow you for several months to check if any new complications pop up. The reason why we want to catch these complications promptly is because we can prevent vision loss if we treat retinal tears and retinal detachments quickly. Previous research has shown us that for patients who have symptoms such as flashes or floaters with retinal breaks found on examination, these patients have about a 40 to 50% chance of going on to develop a retinal detachment. If these retinal tears or holes are treated, that risk drops down to about 5%. So if you have a retinal tear or a retinal hole and we're able to treat it promptly, you can decrease your risk of a potentially blinding retinal detachment by tenfold. That's a very significant reduction of risk. Basically, how we treat these retinal tears is we use a laser to shoot a ring of laser burns around the retinal tear or hole. These burns result in scarring that welds the retina to the underlying tissue, effectively sealing the tear and preventing fluid from going under the retina and causing a retinal detachment. And so, if we catch a retinal tear on an exam, we can offer this laser treatment in the office to greatly decrease your risk of going on to develop a retinal detachment. Now, if a patient has a retinal detachment, then they'll need to undergo urgent surgery to get it repaired to try to prevent permanent vision loss. In retinal detachment surgery, a retinal surgeon goes into the eye with small instruments and removes the vitreous gel, then injects the eye with either gas or silicone oil to push the retina back into place. They'll also use a laser probe to create those laser burns to help seal off the retinal tear. Now, a patient's visual outcome will depend on factors like the location of the retinal detachment, the severity, and how long the retina was detached before it was repaired. Okay, I hope this review of floaters, flashes, vitreous detachments, retinal tears, and retinal detachments was helpful to you. If you enjoyed the video, don't forget to give us a like and subscribe to the channel for updates. And if you live in the Los Angeles, Orange County, or Inland Empire area and want to get your floaters checked out, feel free to visit our website or give our phone number a call to make an appointment today. And if you made it this far into the video, that means you're probably really interested in learning about how to keep your eyes healthy. You can watch my video here to learn about all the latest treatments for floaters. I'm Dr. Michael Chua with Planet Hills Eye Care. See you next time.